Hello guys, this is Dr. Ajinkya here. So in today's lecture, I'll be talking about the 3D anatomy of the dural venous sinuses. Now I remember I've done a lecture very recently about the anatomy of the dural venous sinuses in detail, the theoretical anatomy of the dural venous sinuses, for which I'll post the link in the description panel below. So in today's lecture, I want to focus about the 3D anatomy because I want to show you how exactly from all sides and all directions, I want to show you how exactly the orientation and the connections of all different dural venous sinuses look like. So make sure that if you're watching this video or my channel for the first time, you make sure that first you go and click on the link below, which I'm going to give you in the description panel. Go watch that video first, get the concepts about the anatomy of the dural venous sinuses first clear, and then maybe you can come back and watch this video about the 3D orientation of the anatomy of the dural venous sinuses. So let's begin, guys. So as you can see over here, this is a 3D anatomy model. So most of the textbooks give a lateral view of the dural venous sinuses, so it's going to be like this somehow. So they're going to show a lateral orientation, and they're going to show you the first superior sagittal sinus like this, a huge semicircular structure. So exactly which below we can see the inferior sagittal sinus as well. Now why these are called as the superior and the inferior sagittal sinus? Now if I can turn this 3D model for you guys, you can actually see that these are midline structures. As you can see, this is exactly in the midline. It's not lateralized anywhere, so exactly in the midline, and that's why it is a midline structure and it is singular in number. They are not paired. So also in my previous lecture, I've classified that into two different types about they being paired and unpaired, and also depending upon the location, there's a classification for this. So make sure you watch that video first. So as you can see over here, now what you can see, there's a huge gap in between these two, right? So why is there a huge gap in between these two? Now because there's a structure called as a falx cerebri in between these two. So superior sagittal sinus is on the superior aspect of the falx cerebri, and the inferior will be on the inferior aspect of the falx cerebri. So these are attached to the falx cerebri in the midline. So as you can see very clearly. So now this is really important for the neurosurgeons because they have to enter the cranial cavity from the external approaches, or sometimes along with the skull-based surgeons. Now skull-based surgeons, those who are ENT surgeons, along with the neurosurgeons, they operate as well. So they have to go endonasally and approach the transcribriform plate. So the cribriform plate can be approached endonasally as well. So in that procedure, we call as transcribriform for removal of tumors in the anterior cranial fossa, where we skull-based surgeons operate. So in that case also, as you can see, the superior sagittal sinus tip anteriorly and the inferior sagittal sinus may be encountered if the surgeon is not very careful. So also for them, the anatomy is really important, the 3D orientation as well. So if you can see over here, so also, I'll give a link in the description panel about the video I recently made sometime back about the transcribriform approach and how while operating on a transcribriform approach, you can encounter the sagittal sinuses along with the falx cerebri attachment. So I'll give the link to that video as well. Make sure you watch it out first. So what happens is that this is a nose. We go endonasally, and if I can view this from the superior view, this is the ethmoidal roof. As you can see the labeling over here, and that's the crista. That's the crista galli over there. That's the tip of crista galli, and that's the cribriform plate. So the cribriform plate is it runs along the entire length of the anterior and the posterior ethmoids till the sphenoid planum, and it extends from the back of the frontal bone. So that's the extent of the cribriform plate. So that cribriform plate, we're going to encounter both the superior and the inferior sagittal sinuses, Very rarely, but if you're not careful, they may get injured because it is somehow having an attachment on the cribriform plate. So what happens when we go through the transcribriform plate over here, we also need to remove the attachment of the falx cerebri. Also, we need to remove or be very careful of the meningeal branch of the anterior ethmoidal artery, because we also have to remove that in case of transcribriform approaches. So also we need to remove certain part of the attachment of the falx cerebri. We have to actually cut the attachment of the falx cerebri for complete transcribriform approach. So make sure you watch that video, the link of which I can post down there. So this is the significance of the 3D orientation of the sagittal sinuses in case for a skull-based surgeon. So falx cerebri is going to lie here in between the two. So as you can see over here, if I can just zoom out this further for you guys and just highlight this, you can see that's the superior, that's the inferior sagittal sinus. Now, superior sagittal sinus has a good extent from the anterior most aspect. As you can see over here, it extends, goes up all the way behind posteriorly, as you can see over here, up to the confluence of sinuses as the labeling suggests. Now, that will be the extent of the superior sagittal sinus. Now what happens is that the inferior sagittal sinus also has the same course but is small in size, and here it ends up in the straight sinus. Now many guys are confused about the difference between what a straight sinus is and a transverse sinus is. Now I should be telling you this, that straight sinus, as you can see, if I can orient you in a better anatomical position. So as you can see over here, this is what I call as a straight sinus. Okay, so straight sinus along with the superior and the inferior sagittal sinus are midline structures. It is single in number. Remember that. This is a huge difference. A lot of students make a huge mistake in this very concept. They do not know exactly the difference between what a straight sinus is and a transverse sinus is. They confuse them with each other and sometimes they swap their places. So remember guys, if you are watching this video, please remember this for a long time, that the straight sinus is straight in midline and the transverse sinus goes transversely laterally, and they are two in number as they are paired. As you can see over here, that's the occipital bone, as you can see, and that's the transverse sinus, also called as sinus transversus. Okay, so that is two in number and the straight sinus is only one single sinus. Okay, that's the huge difference. Please remember that always. So what I'm going to show you here, so the inferior sagittal sinus drains into the straight sinus and straight sinus eventually drains into the confluence of sinus. Now as you can see over here, if you get a skull in 3D anatomy model or whatever skull you have of a cadaver, remember that exactly you have this occipital protuberance over here. All these, that's the superior knuckle line and that's the inferior knuckle line, that's the occipital protuberance. Exactly at that occipital protuberance area roughly lies the confluence of sinuses, as you can see right here. This is why the 3D anatomy orientation is really important for surgeons out there. So this is what a confluence of sinus looks like. So you may get a MCQ question for your NEET exams or your any entrance exams, that what, so that saying that because I'm saying this because I've come across this question before, so I'm sharing this with you. So they may ask you confluence of the dural venous sinuses consists of all the sinuses except. So we have superior sagittal sinus, we have the straight sinus, and coming from that we have the transverse sinus. Okay, and also we have this occipital sinus which is coming out of the confluence of sinus. So that we have straight sinus, we have superior sagittal sinus, we have marginal, or we can say occipital sinus, and then we have the transverse sinus. So maybe inferior sagittal sinus does not directly drain, but it indirectly drains into the confluence of sinus through the straight sinus. So now I hope you have the anatomy very much clear. So once we have the confluence of sinuses, now The incoming channel is the superior sagittal sinus and the straight sinus and the inferior sagittal sinus indirectly. So the outgoing channels from this confluence of sinus will be the transverse sinus and the occipital sinus. Now, remember that most of the people do not know about occipital sinus and the marginal sinus right here. What they know about is the cavernous sinus right here and the inferior sagittal sinus, and the rest of the part they forget. So what I'm going to show you here is the occipital sinus, which is exactly also again a midline structure. So what we had so far is the superior sagittal sinus, here the inferior sagittal sinus, here the straight sinus, and then the occipital sinus. All these are midline structures, so they are single in number. Always remember that. I'm giving you a very clear view of this. Again, I'm going to show you superior sagittal sinus, inferior sagittal sinus, straight sinus, and then the occipital sinus. These are all in midline and single. Whatever is in midline is always single. Remember that. Okay. Also, the confluence of sinus is also single in nature. So 5 structures that are single. Okay, so moving further ahead, we know about the transverse sinus now. Now I'm going to show you how exactly the transverse sinus connects with the sigmoid sinus. Now, as you can see over here, if I can just lighten this up, we know that this was the transverse sinus going laterally. Now, initially, if you can see, it is at a higher level. It then bends down. Remember that. It bends down. As you can see very clearly, it bends down here. So it is bending down and in a S shape. It is forming an S shape, as you can see. So always remember, S is for sigmoid and it has got a S shape and is going very much down. Now, all the lateral skull base surgeons out there and the ENT surgeons out there, we all know that our life goes in opening of sigmoid sinus every time. So once we start drilling in the procedure called as the MRM, we encounter the sigmoid sinus and we break the sigmoid sinus in our residency days and the bleeding starts. So I'll show you today that how and exactly this sigmoid sinus is and how it lies. So we know that this is the mastoid bone, right? So if an ENT surgeon is kind of operating on a patient on a mastoid surgery, we all know that the mastoid is drilled and we keep on drilling and eventually we reach the antrum. And if we drill too much, we may encounter a sigmoid sinus, which is right there. So the sigmoid sinus is kind of S-shaped, and then eventually the sigmoid sinus drains into what? We all know that it drains. So if I just remove this mastoid bone for some time, as you can see, I've removed the mastoid bone as in case of the surgery of MRM. What we can see over here is the sigmoid sinus, right? So this is how a sigmoid sinus is going to be visualized. So this sigmoid sinus bends down and keeps on going down eventually until it reaches an area where it meets or drains into the jugular bulb. This is still the sigmoid sinus, and this is the area where somewhere the jugular bulb will be. Okay, so if I want to try to add the inferior jugular vein, the internal jugular vein, so let me see if I can add that. Let me see if I can really add the internal jugular vein somewhere here. Yeah, there it is, the internal jugular vein. So if I add the internal jugular vein, see, this makes my life very easy to teach you guys. So I just added the internal jugular vein here, and as you can see over here, sigmoid sinus is a direct entry into the internal jugular vein. See the labeling here, sigmoid sinus so far here, and then internal jugular vein directly starts. Now that's the area you can see over here is the jugular bulb actually. So we first encounter the jugular bulb and then the internal jugular vein. So the sigmoid sinus actually drains into the jugular bulb and then continues into the IJV. And then further down from the IJV, we know where it goes. So, but there's a catch over here. It's not that simple. Sigmoid sinus goes into IJV, we all know that. But there are 2 other structures that also drain here, which very few people know about. But let me clear the concept right here. So as you can see now, if this view is much clearer, I guess, yeah. As you can see over here, what is this? This is what? This is the superior petrosal sinus. And what is this? That is the inferior petrosal sinus, right? So now what are these petrosal sinuses? Now we have the squamous part and the petrosal part of temporal bone, right? So that is why the name is given as petrosal, the superior petrosal and the inferior petrosal, because there are two, just like the sagittal sinuses, two superior and inferior. If I give you a superior and a central view here, you can see that this is a sigmoid sinus. Now this sigmoid sinus is actually coming from up and then going down. Okay, so what you can see over here is the superior petrosal sinus. If I can give you a lateral view of this, yeah, this is much more easier now, I guess. So this is the sigmoid sinus initiation, and that was the transverse sinus. Similarly, the inferior petrosal sinus drains into the jugular bulb. Okay, as you can see over here, I'm going to give you a very much clearer picture of this inferior petrosal sinus. As you can see, the labeling suggests it is directly going into IJV and not the sigmoid sinus. So as you can see over here, I have the classification of that, the classification and frequency of drainage of the inferior petrosal sinus, as I just showed you. Now the superior petrosal sinus may drain into the transverse sinus and eventually in the sigmoid sinus, but there's a whole lot of classification system for the drainage of the inferior petrosal sinus into the IJV. Now there are type 1, 2, 3 and 4, suggesting that it directly enters into the jugular bulb, or maybe the jugular bulb to the deep cervical plexus through a communicating vein, or maybe represented by a plexus of veins, or maybe directly into the deep cervical venous plexus. But as you can see, nowhere it's mentioned that this will drain into sigmoid sinus. So the inferior petrosal sinus never drains into the sigmoid sinus, that's for sure. Now, this classification was given by the Xu et al. And the other classification is given by Miller et al. So you can see both have 4 types of classification. Now, in all these classifications, we can see that there is no way mentioning of the drainage in the sigmoid sinus. Okay, as you can see over here, it does not drain there. So I think this classification is really important at a higher level for skull base surgeons and the neurosurgeons and the lateral skull base surgeons as well. So remember this point: the superior may drain into the sigmoid sinus, but the inferior will never. Okay. So as you can see over here, the superior may eventually drain through the transverse into sigmoid, but the inferior will always drain into the IJV or any other ones, but not the sigmoid, because it does not have a retrograde flow. And as I have mentioned before, that the dural venous sinuses are valveless. They do not have valves. So they may have blood flow direction in both the areas, or you can say it can flow in both the directions. So that you have to remember, but it will never flow, or it will never drain into the the sigmoid sinus. Okay, the inferior petrosal one. So I hope this concept is very much clear for you guys. So that was all about the petrosal sinus, the sigmoid and the IJV drainage. Now the most important thing of all is the cavernous sinus. Okay, if I can zoom this for you guys and give you a much clearer view over here. So as you can see, this is the cavernous sinus. Now first of all, I'll give you a midline image. As you can see, now this is now, okay, wait a second. Okay, now this is in midline. Okay, now that's a midline structure. Now as you can see, this is midline, but you can see 2 cavernous sinuses on either side because they are not midline. Okay, they are not midline. So cavernous sinus is seen 1 on either side. Okay, so that's a very huge concept we all have to remember. Now, being an ENT and a skull base surgeon, I always have to deal with the cavernous sinus because they are like the mainstay of our surgeries in skull base surgery as well. So we need to know a lot about the cavernous sinus as well. Now, as you can see over here, now the cavernous sinus starts anteriorly and goes posteriorly. Now, you should remember what are the incoming channels to cavernous sinus and what are the outgoing channels of cavernous sinus. All this I have explained in my previous video, so you need to understand the anatomy. So I'll stress on this fact again that you should see that video first, and after that you come here. Okay, so this is the cavernous sinus over here. The incoming channels would be the superior ophthalmic vein, inferior ophthalmic vein, anterior facial vein, common facial vein. All that drains into cavernous sinus. So roughly some of the other veins, so mostly the orbital veins drain into cavernous sinus over here. So that is really important, you have to remember. So the most of them is the SOV and the IOV, which commonly drain in the cavernous sinus. Also, there are a lot of communicating channels that connect the cavernous sinus with the pterygoid venous plexus. So also that you have to keep that in mind. So once the cavernous sinus is reached, we should know that the cavernous sinus also has got outgoing channels. Okay, so as you can see over here, the cavernous sinus has got outgoing channels. One of them is the superior petrosal sinus. Now, which we just discussed right now. So this is a superior petrosal sinus. Okay, the superior petrosal sinus. Okay, so that is a outgoing channel from the cavernous sinus, which eventually drains the pathway which I just mentioned, and then finally in the IJV. So this is how the cavernous sinus works. Also, we also have that two cavernous sinus. I always keep saying this on my lectures on the cavernous sinus, that cavernous sinus is not just on the left and the right, but it's also in the midline through communicating channels. So you must have thought about this key, what connects the left with the right cavernous sinus and vice versa, right? So they have connections. Though they are apart from each other, they are separate from each other, they are still in contact, right? They cannot stay away from each other. So they have incoming and outgoing channels, as well as they have interconnecting channels that are seen in the midline. So what is this? As the label suggests, is the anterior intercavernous sinus, and this is the posterior intercavernous sinus. Okay. Also, we have superior intercavernous sinus as well as inferior intercavernous sinus. Now, on my lecture on the anatomy of the cavernous sinus, I have mentioned each and everything about the cavernous sinus in detail. So make sure that if you want to know or learn about the cavernous sinus, you can go and check my video out on cavernous sinus as well. So basically, I've made videos about all the anatomy of whatever structures you get in skull base, ENT, ophthalm, neurosurgery. Most of them I've covered in my topics. So make sure if you like it, you can go and watch them. So we have anterior, we have posterior, we have superior, we have inferior. So the cavernous sinus is connected to each other from all the sides. So they go and drain as well as in the basilar plexus. Now we all know that basilar plexus is behind the clivus. Now what you have here is the posterior occipital, that's the posterior cranial fossa, right? So that's the sphenoid bone. So as I have talked about the sphenoid bone last time in ophthalmology lectures, that's the sphenoid bone. What you can see over here is the lesser wing of sphenoid over here. That's the anterior clinoid process over here. And if I can show you, that's the superior orbital fissure, that's the optic canal. So this is basically the superior view of the sphenoid, and the sphenoid sinus will be somewhere at this level below this. So this becomes the clivus. So that becomes the clivus of the sphenoid. And behind the clivus, if we want to access the basilar artery and the vertebral artery, most importantly, the posterior circulation of Willis. So this is a foramen magnum, right? Here will be the vertebral arteries on either side, forming the basilar artery over here, and then the posterior circle of Willis, which communicates with the anterior circle of Willis. Okay, so I'll show you in my next few videos, my upcoming lectures, I'll show you the entire 3D anatomy of how the circle of Willis is formed. But also, if you want to know about the circle of Willis in basic anatomy, I have made a video of that as well. So make sure you go check it out. So this is a basilar venous plexus over here. That's the basilar venous plexus, a huge venous plexus which you can see over the clivus region. You have to drill the clivus to access this. So as you can see, this is the anterior. So we skull base surgeons, what we do is that we access the sphenoid as a whole, and we go inferiorly and we can drill out the clivus bone from here. But doing so, to access the vertebral and the basilar artery, we need to take care of the basilar venous plexus over here first. Otherwise, it's going to bleed like a lot. So That's the basilar venous plexus, and we have the marginal sinus as well. So never forget about this marginal sinus as well. This marginal sinus is also really, really important. So that is how the marginal sinus works. So 1, 2, and 3. These are all marginal sinuses. So I think there's one more sinus which is left out, is the Parietal sinus. As you can see, the label suggests over here is the Parietal. Now, why it's called a Parietal? Because that's the sphenoid bone right here, and that's the parietal bone. It's going up. Okay, so that is so about the Parietal sinus as well. I have explained in a lot of detail. So if I can show you right here, it's going to be right here somewhere around Parietal sinus. Wait a second. Okay, as you can see over here, that's the Parietal sinus. Now it has a huge clinical significance because now there was a previous misconception about the thing that the Parietal sinus it actually was a union of something else. But today's research suggests that the Parietal sinus corresponds to the artificial combination of two venous structures. That's the parietal portion of the anterior branch of the middle meningeal vein. As you can see over here, this is the Parietal sinus. It's earlier what we used to think is that it's a continuation of the superficial cerebral vein. Okay, superficial middle cerebral vein, but that's not the case. It's actually a combination of the middle meningeal vein and a dural channel located under the lesser sphenoid ring right here. So earlier we used to think that it's a continuation of the middle cerebral vein, but no, that's not the case. It's a combination of it's a combination of the middle meningeal vein and the vein from the lesser wing of sphenoid. So that's a huge concept. I read a lot about this. After that, I got my concepts clear. So if you want to know about this, just read whatever you can see on the screen right now and try to understand that. So moving on further, I think these are all the dural venous sinuses which we can encounter in our day-to-day life, neurosurgery, skull-based surgeries, and for MBBS students as well. So I think that's all about the dural venous sinuses in 3D anatomy. So I really hope that the concepts are very much clear for you guys. So if at all you have any doubt in this video, anything you are not, you don't agree with what I say in this video, please feel free to comment below in the comment section. I'll definitely try to make your concepts more clear. And if you have any doubt, if you need to understand something, if you want to learn something new, just drop your comments and I'll try to teach that in the next lecture. So till then, take care guys. Thank you so much.